Good afternoon, everybody, and welcome to today's webinar, our webinar on inclusive standards. We'll talk about more in particular about the European Commission study on anthropometrics in harmonized standards, a webinar that we're organizing, by the way, in cooperation with DG GROW. My name is Els, and I will be moderating the webinar in the background. So please feel free to enter your questions in the Q&A panel of this webinar. You're all by default muted, so you cannot speak out loud, but you can use that panel to submit your questions. Should your question be unreplied at the end of the session, please don't worry, because we intend to make a Q&A report available afterwards. We are also recording this webinar, so you will be provided later today with the recording and the PDF version of this presentation. Should you be on Twitter, please feel free to talk about the webinar and the topic. Of course, we at CEN CENELEC you can find us via the handle @standards4EU. So without further ado, let me take a moment to introduce the speakers of today. My colleague Deborah Wautier is Project Manager Policy and Partnerships, is here today to introduce you a bit on inclusiveness. We have the pleasure to have Mrs. Frauke Ros from the Commission. She's working at DG GROW as a policy officer. And then we have the pleasure to have Sandra Alemani and Gert Kuchmeister here today. They're both experts in working group 1 of CEN-TC 122. So please, Deborah, the floor is all yours.
Thank you and good afternoon, everyone. So yeah, this is the agenda for today. I'm going to go quickly looking at what inclusiveness means in the CEN and CENELEC system. And then Frauke will take on the floor and give more details on the ongoing study on anthropometrics in harmonized standards that is led by the Commission. And then we'll hear from Sandra and Gert, who are indeed experts in anthropometrics, and they will share their experience on the importance of inclusive data and the lack of inclusive data and what that means for standardization. They have a great example on a recent exercise that they've led on anthropometrics data of children in standardization. So stay tuned for that. And then we'll end by turning to you, our experts, for your contribution to this exercise before some time for questions that you might have. So I will start. I think that for all of us who are involved in the CEN and CENELEC activities, we know that inclusiveness is very much part of the DNA of our system. We have a long-lasting commitment from CEN and CENELEC and our members towards an inclusive, transparent, and open European standardization system. And as technical experts, you must have heard that a lot in the discussions within your technical committees or working groups, I'm sure. Being inclusive, of course, means many different things. It's about, for example, making sure that individuals in the drafting processes have equal opportunities to participate in the making of a standard, of any type of standardization deliverable, regardless of their backgrounds, of who they represent, being a small business, an NGO, or whatnot, regardless also of their individual characteristics, such as their gender, their age, their ethnicity, their disability, etc., etc. But inclusiveness is also making sure that the end deliverables themselves are fit for all users, regardless of the user's specificities linked to the same parameters, so gender, age, ethnicity, disability, etc., etc. So inclusive is very much the standard of our system, and that's why it's no coincidence that it's reflected as one of the 5 goals that we have identified in the joint CEN and CENELEC strategy 2030. Indeed, it's the 4th goal. Of course, as standard makers, it's clear that our ultimate objective is to provide tools that ensure that products and services are safe for all citizens and all users. We know that the more diverse the people around the table when we draft standards, the higher quality will our deliverables be. So this is why inclusiveness is, of course, a no-brainer for us. Higher quality meaning, of course, standards that benefit everyone equally, standards that are inclusive of all the needs and all the specificities of the end users. And so an inclusive standard is a standard that ensures that the product or the service benefits all users equally. So this inclusive equation, if you will, is true, for example, for gender or sex-related differences, but also looking at the specific needs and capabilities of a child versus an adult user versus an older user, and how the different stages of life can affect the use of a product or a service, depending on the age, but also circumstances, environment, et cetera, and how that impact a user. So Frauke, of course, will give more specific example in a second about this, but it's important for us standard makers to keep this in mind when we draft any standard, really, because we know that some standards that underlie the safety of certain products or services can have a role to play in making sure that they are safe for all and that they don't further create inequalities, between its users. So CEN and CENELEC are very much committed to this, and to do that, we are involved in several activities and initiatives to ensure that inclusiveness remains at the heart of our system. One of the ways we do this is, for example, with our CEN CENELEC Gender Action Plan. It's actually the second one that started earlier this year. We have actually a dedicated webinar that explains all of this in detail, so I won't go into too much detail now, but the work on gender responsive standardization within CEN and CENELEC was very much boosted by the UNEC declaration on this topic, which CEN and CENELEC have signed in 2019, together with more than 20 of our members who are also individual signatories of the declaration. And of course, many of our members also have national gender action plans that complement the work that we are doing at CEN CENELEC level, but also the work led by ISO and IC at international level. Because indeed, there's a super strong global commitment of the standardization community towards gender responsive standardization. For example, in the past few years, there have been many tools, checklists, guidelines, webinars, and trainings that have been developed, among others by ISO and IC or by UNEC, for example, to help you standard makers draft gender inclusive standards. Again, all of those are listed in the dedicated webinar on gender, so I'm not going to go too much into details for this, but you might also be familiar with the work led by SAGA, that is the CEN Strategic Advisory Group on Accessibility, and of course the Design for All approach and the protocol that's available for standard makers, which precisely looks at inclusiveness in standards, taking into account the diversity of end users of a product or a service, diversity in terms of profiles and therefore competences and abilities, and thus user needs. So all of this to say that what it's clear is that we have a very strong commitment towards inclusiveness, and in that sense, we welcome any progress on that front. So that's why I'm very happy to have Frauke today from DG Grow to present their ongoing study on anthropometrics in harmonized standards. Frauke, the floor is yours.
Thank you for the introduction, Deborah. So my name is Frauke Hoss. I've been working at the European Commission for 8 years now. I've joined this unit at DG Grow. Our unit is machinery and equipment, maybe a year and a half ago. Our unit has 22 different pieces of legislation, and we have everything from recreational boats to explosive equipment, lifts, machinery, personal protective equipment, radio equipment. So we I've heard once that we had like 70 or 80% of all product standards, European product standards, would fall under our legislation in this unit. Deborah, if you could show the next slide. And so when I joined this unit, I was quite fresh at DG Grow, and there was this retirement party, and we had this very small colleague, like she's literally up to my shoulder, and she was complaining at this party that the masks for the pandemic didn't fit her. And I was new to the unit, and I was a bit surprised because the directive for protective equipment is in our unit. And I thought, well, let's fix it. No, I mean, if this is a problem for us, it's a problem for everyone. This should be solvable. And Deborah, the next slide, please. And those for you who are working in personal protective equipment know the background. I didn't, and so I went to the colleague who was responsible for this directive. And what I found out is that the old standard, the current standard for protective for masks is basically you need a doll that blows air, and then you sort of see how much air comes out of this mask, right? And that doll needed a face. So in the 70s in a Sheffield laboratory, there was a man called Jim, and they took Jim's face. And Jim is apparently still alive today. It's a guy in his 80s. So, you know, and every mask was tested on Jim's face, basically, which is not representative for women, obviously, but most men also don't look like Jim, right? Next slide, please. And so you had the face of the doll that was Jim, but there were more provisions in the standards that sort of implies that masks only were worn by average-sized men. So, for example, it says a panel of 10 clean-shaven persons should test the masks, which implies that they're male, but it also implies that most men don't wear beards, right? Which is not true in many cases. And then there was another one that said that people testing these masks should be familiar with the equipment, which was true as long as masks were being used in a medical setting, but it wasn't true anymore once the pandemic broke out. Next slide, please. And so the colleague who was responsible for this, he said, yeah, Frauke, but the whole world has realized you're a bit late, you know. And there's actually being an update being done at ISO, and they have taken a more international data set, and they've come up statistically with 5 statistically representative faces. And that's hopefully what's going to be used in the new standard. If I understand correctly, it's still under development. And we had a good time guessing in the unit who of the 2.5 of the 5 faces should be female, right? So we were trying to guess which ones those were. Next slide, please. But then the colleague said, you know, from us, we're aware of the problem, but open any standard, it's everywhere. And I kind of thought, you know, what do you mean, you know? And so I opened another PPE standard and on protective equipment for your eyes. So you need them for welding or skiing. And it turned out that these kind of glasses are tested on the 50th percentile adult male and on the 60th percentile 12-year-old child. Women don't figure at all. And again, like most people are not average or the 50th percentile. Next bullet point. And then I was personally responsible here in the unit for radio equipment. So I opened the radio equipment standard on the radiation being absorbed by your head. And for that, I think the standard's from 2020. It's not very, it's quite new. There was no data on how big your ears are, right? And how the proportions of faces and heads, basically. And so what they did, they used data from 1988 from US soldiers. And I mean, that data is outdated. Again, US soldiers, I'm guessing in that time were mostly male. You know, I've been told that probably the effect on radiation in your head is not devastating, but nonetheless, the database being used here could be better. Let's say that. Next slides. And so the more I looked into this, the more examples you find, and there's actually a whole book on this. It's called Invisible Women, and it goes from everything from medicine, horseback riding, pianos. Once you start seeing it, you see it everywhere. And what I found interesting is she has this book, Invisible Women, and she also has a podcast called Visible Women. And she keeps repeating that standards are the solution to this problem. Like she keeps saying standards, standards, standards. And I think it's one of the few times that something quite as technical and also bureaucratic as standards gets so much attention in the media. And I think that's a compliment. She, by the way, is also the person who fought for the first woman to be on a pound note in the UK. So she's quite widely an activist, I would say, at this point. But yeah, but if you look for a to-do list, this is a long to-do list for all of us, I guess. Next slide, please. So I want to set up a study because we have, I think, 3,500 standards in the remit of our units. And I kind of asked myself, you know, if I ask somebody to look at this, what would a good standard really look like? And this, this is for sure not perfect yet, but that's the definition I have used for the study. So one thing is, I think there is a confusion between equality and equity. So I had someone inside the commission tell me, oh, everything should be unisex because we're all equal, right? And I thought, oh my God, if all clothing was unisex, that'd be a disaster, right? Nobody wants that. So what good standards are, it's equity. So we are all different, but we should all be equally safe. And that's regardless of our gender, our age, our height, how heavy we are, all these things. Next point. Then the big question was, what you can only build one seat. So only men can be safe. Like, this is like one of the comments I got. And indeed, I think there are a lot of solutions, technical ones, where everyone can be equally safe. You can have masks in different sizes, but sometimes you can only have one solution. In that case, the risk should be equally distributed. So when I use that product as a woman, I should be equally likely to get hurt as if I was a guy or a man using that product. Next point. And then obviously very important, has to be based on recent representative data, which is maybe the most difficult point among these. Next. And then I realized while I was looking through standards for inspiration, it's not just the design of standards, it's also the testing of products, right? So GIM is actually, it's a testing issue because the masks are tested on GIM. So it needs to be both in the design and the testing phase. We need to consider inclusiveness. Next point. And then I'm an engineer myself. I'm a civil engineer, and one of the things I was drummed in my head was to never use averages, but to make bridges and everything for a range of things. So if you make a highway bridge, you obviously don't make it for the average car, but you don't want it to swing when a small smart crosses it, and you don't want it to collapse when a truck crosses it. So it's important that I've seen quite a few standards that works with an average or a 50th percentile. And I have been told, at least at Technical University, that that's is not a good way. Next, please. And then something I have found is, there are different ways of describing a body. And so, for example, I have quite a few colleagues who come from the automotive policy field, and their person is described by height and weight, full stop. But the difference between men and women is that our skeletons are different, right? So this whole idea of different skeletons has, different hip bones has not been considered. There's also differences in, if you are very muscular and strong, you're less likely to get hurt, and then if you're like, an old man, So it's quite important that you look at the dimensions or characteristics of bodies that are relevant for the safety or for this product. Height and weight is usually not enough to describe a body. Voila. So like I said, I realized that many of our standards had this problem. And it's not to say that this is like a shortcoming in that sense, is, like standards have made the world a lot safer, right? But in Jim's times when they made these dolls, it was the first time that firemen had masks. It was completely new. They were happy to have masks, right? But in those days, when you became a fireman, part of your job interview was to fit that mask. And if you didn't fit the mask, you didn't become a firefighter. So all firefighters basically had the same face shape and same size of face, and that was okay because it was better than not having a mask, right? So standards made the world a lot safer, but I think we just simply have evolved, and now we don't want people to fit equipment, we want equipment to fit people. And so I think it's not so much, I think we're sort of building on the generations before us to make it more sophisticated to fit our times, I would say. And so I kind of had a long discussion how we would screen 3,500 standards to sort of see which ones needed an update. And we decided to hire a consultant, which is an Italian consultant who started in January. And they have 3 tasks. So one task is to make a methodology to screen so many documents. And explicitly, we want them to do that, so that we can use that same methodology for all other standards. So, I was limited to the ones in the remit of our units, which are 3,500 standards, but there are many more, right? So that's the first task. The second task that they're busy with now is to actually screen these standards, and I want them to come up with a list of priorities. So the ones that have the standards that have the biggest impact on safety, that are not inclusive, I want that on a list. And if possible, I want the impact quantified somehow. And then the third is a bit more of an intellectual exercise. It's workshops to bring, my original idea was to bring a technical committee with one of these standards together with the people actually using a product to sort of see if there were any gaps that we had overlooked. Voila. Next slide, please. But, you know, while I was doing this, I realized it's all very nice. And at the end of the year, we have this nice list with standards, and then what? Because I Googled a bit, I looked at the different standards for anthropometrics. I think the biggest big measurement campaign for adults was 20 years ago, I think in Italy and Germany, I think. But we don't have from Cyprus to Sweden and from Portugal to Bulgaria. We don't know how big and strong Europeans are. You know, we don't, there's apparently 200 different parameters you should measure about the body. We just don't have that data. And so while this project is ongoing, we are working with Deborah and her colleagues to see how we could at least do a feasibility study to see, you know, if we were to measure this data, how would we do this? How many people would we have to measure? What would that cost? What are the different options? And once we know, you know, what the way forward is, we can start asking, how would we make this possible? But that's, you know, to come. Next slide. Yeah, so the scope of the study, like I said, it's really limited to the legislation of our unit for the simple reason that's how the commission works, I'm afraid. But the idea is that the methodology is extendable to all other standards like medical devices and all these things. Next slide. As the timeline, so they made a huge database with all the standards and their abstracts that they're searching with a computer model. They have identified the standards with anthropometric provisions, and this is where we could use your help. There's one, they made a list of technical committees that they think, or we think, are writing standards that have an anthropometric dimension. And they've made a list of standards that they think have an anthropometric dimension, and I think it's 1,200 standards. And if you have time, some technical committees just have a few, others have a few dozens or maybe even hundreds. If you see any standards on that list that should be on there or should not be on there, let us know, because it saves us time. Because in the third phase, what they're doing now is they're actually opening every single one of these standards. And of 1,200 standards, I think they will be able to look at like maybe 400. To get an idea, and I've asked them to look at standards across all technical committees. Once this phase is done, the next phase will be prioritization and assessment. So they will look at which of the standards that are not inclusive have the biggest impact on safety and health. And then the last phase is the workshop, probably with the technical committees that have the most standards that would need an update, but we haven't decided yet. Next slide, please. And just to give you an idea how they do this, so they made a grid with different questions according to the criteria that I had presented to you. And so they take a standard, they open it, they read the text, and then they make, for each criterion, they make an assessment, how well does the standard correspond to these different characteristics of what makes a standard inclusive. And so based on these 5 different dimensions, they then make an assessment. This is a good standard in terms of inclusiveness, or it's not. Next slide, please. So in DG Grow, I think we've realized that there's a lot we can do. So what I presented, the study is about existing standards, but obviously we don't want to make standards in the future anymore that are made for the average man. So we are working with a legal service to have a provision in the standardization request to have that included. We have the study ongoing, and like I was saying, for the data collection, we are trying to get a feasibility study started to see what a measurement campaign for anthropometric data would have to look like. Next slides. And voila.
Thank you
which
so
is
much,
really good.
Frauke. I like that we're going from the gym era to the next era. But before I give the floor to Sandra and Gerd, we have a question that's directly replying to what you just mentioned from John Wood. Just to confirm, the study relates to anthropometry of the head, question mark. So maybe you can address that directly.
So yes, it's everything. I mean, so what the consultant is doing, they're literally searching the standards for words like test person, head, foot, seat, anything that has to do with the human body. And if that occurs, then the standard is included in the study. But it's really anything to do with a human. And, you know, there are very few products that are not for humans. So that's why such a big percentage of standards has been identified as relevant.
Thank you. Thank you so much. And now I'm super happy to give the floor to Sandra and Gert, and I'll be changing the slides for you. Go ahead, Sandra. Thank you.
Okay, thank you very much, Deborah, for the introduction. So I'm Sandra Alemany. I'm working at the Institute of Biomechanics of Valencia, and I'm representing the technical project leader 2 of the anthropometric and strange data of children to use it in standardization. So the objective of this project is to identify, acquire, and measure the anthropometric data of children required by relevant stakeholders. In principle, standard writers, but we also consider designer companies or other people that need to design a product or an environment for a child, and it's required to take decisions about decision safety and all these things. And also we are including a guideline about how to apply the anthropometric data in the standardization process. This is going to be presented in more detail later on by Professor Gerd. We consider in this project anthropometric data both types, body measurements, and also physical strengths. And this is also an important element because there are not many information available about physical strengths, in particular in children. And all the information, the objective is to be published in several technical reports. Next, please. So this project is led by the Working Group 1 Anthropometry that is part of the Technical Committee 122 of Ergonomics. But from the beginning, we have also the participation of several technical committees that are working with children products. You can see here safety of toys, sport and playgrounds, park machinery, hearing protector, furniture, tester and clothing, childcare articles, too many products. So at the end, the result was a super long list of specifications and requirements for the project. Next, please. So the project was conceived in 2 phases, and phase 1 was research on demand and availability of anthropometric data. So the objective of this phase was first to analyze which is the available anthropometric data of children that can be used for standardization. And the result in that point was that most of the updated or more or less recent anthropometric available was very fragmented and focused on very specific age group of children. So it was difficult to expand this information to all the age categories. Or other studies focus on a short list of body measurements that are really covering not too many requirements of the project. So the results of the gap analysis was that we need to do a complete anthropometric survey in Europe to cover the needs, the needs of the stakeholders. And the other problem was that few specific databases that was very representative using a 3D body scanner and with a high sample size and so on, was in hands of private companies or research organizations, and were limited by intellectual property rights. So it was impossible to have this information and to use it and to share it for the purpose of the project. So all the results of the phase 1 of the project was published in a technical report of ergonomics. You can see the results there. And we did a workshop about the use and the application of this technical report. And I think it's open and you can see in the website of CEN. Now the project is more or less in a 50% of progress, in a 40% of progress of the phase 2. The phase 2 involves two tasks or sub-projects. One is focused on the anthropometric campaign in Europe. And so the objectives in this section of the project is to use the few anthropometric studies available and to process it and to include it in our needs. Then to develop the anthropometric campaign in Europe. This is the big effort. We are measuring in parallel in Spain and also in Netherlands to cover two European countries, one representing the south part and one the north. We include also activities related to the assessment of the data, controlling the quality, we are going to do the processing of the data and the integration and analysis of all these databases to at the end generate the statistical tables that will be published in the technical reports. And in parallel, we have the project of the guidelines that will be explained in more detail later by my colleague, Professor Gerd. So next, please. So as I mentioned before, we try to cover a lot of sectors, and we did a first review of standards, and we built a list of anthropometric dimensions of more than 200 dimensions and strengths. And it was a preliminary list, part of a questionnaire that were distributed in more than 300 or 400 stakeholders in order to see which are the priorities. We also did workshops and interviews in order to do a better interpretation of the questionnaires and to establish the priorities in the long list of anthropometric dimensions. Next, please. So finally, the measuring campaign that we are doing now, it's covering from 0 to 16 years old. From 0 to 3 years old, we are dealing with 93 anthropometric measurements and 6 strengths. We need to consider the limitation of measuring this group of age. From 4 to 16, we have 186 measurements and 14 strengths, so it's a lot of different data. And you have also there are the tables of the stratification of the sample size in different age groups. You can see, especially at the beginning, an stratification in each 3 months, because the growing rate in this period is too high, so we need to focus in small age groups there. So in the case of the children population, apart from the anthropometric variability within an age group, we need to consider that the age is introducing a lot of variability. Children are growing, and also the tempo of the growing is varying individually. So to combine all this diversity to characterize in a good way children requires a big sample size. And at the end, a lesson learned from this project is that a key point is how to balance or to agree a cost benefit between measuring in different points, in different sample size, and have a good stratification, and in the other hand, to measure a long list of body measurements. Long list means long measuring sessions, and at the end, this is more time measuring and more money for this. So this cost benefit is a key decision in the preparation of the study. Next, please. So science, I mentioned before, from 0 to 3 years old, we are using mostly anthropometric devices. Some of them were designed and built specifically for the project because there are not commercial systems or commercial devices to gather the measurements that we defined in the campaign. So it was also a challenge in the project. Next one, please. And from 2-3 years old, we are using digital tools in order to be able to extract a longer list of body measurements from 3D body scanners. I would like to mention that our age group starts in 0 and finishes in 16. So if we are going to plan a future study in adults, it would be good to consider this and to cover the gap between 16 and 18 and not to have a gap there. Next, please. And yeah, and finally, I would like to mention the challenge of forces. So we have 16 different forces defined in the project. Again, there are not commercial equipment to do this, so we did a design of a specific force station together with 4 load cells and the design of different accessories to measure of all these forces in the project. Next, please. Now, finally, we have also a good job trying to combine all the databases coming from the different sources. The previous one, the existing data, and also the campaign done in the project in Spain and Netherlands. So we need to avoid bias due to the methodologies, and we need to control all this in a specific process of data integration. Next, please. Yeah, and it's all from my side, so I give the floor to Professor Gerd.
Thank you, Sandra. After 35 years of practical anthropometrics, I'm still a doctor. Thank you for the scientific upgrade. I have to hurry up. Most of the work is done by your team, but a little bit has been left for the guidelines. Why are we writing these guidelines? We have demands from our user groups and our stakeholders, and we want to present the survey data as the basic data plus transfer information for application cases. Next, please. We follow a user-driven approach. We think that there are the following user groups and stakeholders: standardizers, designers, product evaluators, safety engineers, scientists, statisticians, and laypersons too, by the way, who pay us. So these are our target groups. I come directly to the sense of the guidelines. Next, please. What Sandra and her team is going to deliver is in the middle of this slide. There are the data, sociodemographic samples, percentiles, statistical information, description of the body measure, description of the measuring method, and of course the statistical characteristic. This is typical for an anthropometric content in a standard. What we need and why we are writing the guidelines is that we have a loss of ergonomic and anthropometric competence in applying data. Frauke gave us a lot of examples what happened when we just apply data without thinking about out of what populations they come, who has to be included, and so on. The shortcomings in inclusion has always been a question of applying and not of measuring the people. So the transfer information about the variability of body measures and body strength is very important when we want to reach our game of inclusion. There are two fields where the transfer data are necessary. I just give you a short list of examples. The one field is directly connected to the diversity of the human body. There are different proportions in different sexes. There are different body fat distributions. There are different strengths, there are different dimensions, and there are different skeleton differences. Frauke has mentioned some of them already. So for each data Sandra and her team will publish, we will have additional information. Take care when you apply these data, take care, because the statistical characteristics don't tell you everything. And on the right field, the gray transfer data field, we have differentiations in the interaction of the variability of body measures with all equipment and clothing near to the body. And this is something else than the biological and biomechanical and physiological on the left. This is the interface interaction, which is not the same for all groups of the population. We have difference in clothing. We have difference in the shape of where we have contact to the body protective equipment. And we have different demands by hairs and nails and so on, which is necessary to have a safe and comfortable and efficient interaction between the body, the variability of the body, and of the supporting or protective system of elements of the technical environments. And because we know that we have stakeholders from the PPE region, there is an influence of anthropometric data on thermophysiological processes, of sweating patterns, and so on. These pieces of advice will be given in the transfer data. And let me say one thing. Two things are necessary to reach your targets, your aims. The actualization of data, of course, which is the middle part, and high quality guidance that will protect us from those bad and misleading decisions we have heard in many examples. And to finish with one example from the children, next please. These are representatives of the variability of children. They are not actualized. We are waiting for the new data from Sandra and her team to be sure that whenever we have usability dummies, for example, these are not crash test dummies, but they are usability dummies. You see they are quite slender. They do not meet any longer the development in the field of body weight, body circumferences, and body fat distribution. So basic thing, actualization of data and high quality guidance for the application of them. Thank you.
Thank you so much, Gerd and Sandra, for this very super interesting explanation. I know also that a couple of years ago you did a dedicated webinar on this topic, so we'll also put the link in the chat. Now, our listeners might be thinking this is very good and very important, and I see in the chat there's a lot of questions, and we'll get to that in a second. But what does it have to do with me? Well, Frauke already mentioned it. The consultancy that is running the study from the commission side is looking for support. Indeed, if you are part of a TC that drafts standards in support of one of the 22 legislations that Frauke listed, so the ones under the DG Growth remits, you can help. and you can actually contribute to the commission exercise. This is on voluntary basis, but it would greatly help DG GROW in assessing and validating the methodology that they've developed to identify those harmonized standards with anthropometrics. And I see again in the chat that there are some questions already on how to do so. So this slide is summarizing it. To do so, you can directly get in touch with Frauke or myself, and we'll redirect you on where to go. There is a list of the harmonized standards that have been already identified and pre-marked as a anthropometric sensitive, if I can summarize it like this. So we can share that at the end of the webinar as well. And your support is very welcome by the end of June of this year. So again, if you fall under that remit and if you have time to contribute to this validation step of the methodology, get in touch with us, please. Those are the few key takeaways from today. I think it's very clear that inclusiveness is a core value of the CEN and CENELEC system. Inclusive standards are standards that benefit all, not only women, as we've heard with many examples. It's inclusive standards mean standards that are taking into account the entire range of differences, from children differences to people with disabilities, people of different age, and of course, sex-related anthropometrics differences. Having diverse and inclusive standards make for higher quality standards that protect everyone and reach greatest market acceptance. As a default approach, standard makers should assume that all standards you're working on have possible implications on individual level. And as a CEN and CENELEC expert, you have a role to play. There are extensive tools and guidelines and checklists available. I've mentioned the Design for All protocol. There are a couple of gender-specific checklists as well. Remember to always use representative data when they are available, of course. And last but not least, please consider contributing to the DG GROW study. Now we have 12 minutes left for the many questions that we have. And that's going to be a nice thing to do for me, because people mention study and I don't always know if it's the one presented by Sandra and Gerd or the one in question from Frauke. So let me start maybe from the end. I think the question from Anne-Sophie Caro, does the studies also include minorities in the population? Actually, she said studies in plural, so that would be for the both of you. Gerd, I think I see you're already unmuted. Do you want to answer first?
Yes, of course. We don't differentiate between the averages of the subjects. We are measuring a representative sample of the inhabitants of Europe. That's the definition. And who is here can and will be measured if she or he agrees. So minority, we don't know minorities. We are always at the edge of a racism scandal when we talk about minorities, and we just regard the inhabitant population. That's the policy for European anthropometrists.
I see Frauke is nodding. Frauke, do you want to complement this?
Yeah, I agree. So I think we're in the step before with our study. We're actually only identifying the ones that are, either not looking at human data correctly to begin with, or look at it like insufficiently with only the average man. And we don't propose the solution yet at all. But I would completely subscribe to what Gerd is saying. Like, we will. The idea is to have a representative data set, representative for the European population, and so that includes everyone.
Thank you. And Frauke, since I have you here, I'm also going to ask you this one. So Carl asked, can you share the list of the standards that have been identified by DG GROW to assess their inclusiveness? The answer is yes. I think that was mentioned just now. The second question, though, is can you share the method for how the standards are assessed regarding their level of inclusiveness?
So I speak under the control of our consultant. I see that's Alessandra from our consultancy team. She is participating as well. So the methodology is fully developed, but it's still being fine-tuned based on what they're finding in the standards. So I think it might be a bit early, but yeah, we will publish it for sure. The whole report gets published front to back with all the stuff because we want people to use it, and it's the whole idea is that you apply it to different policy fields. Voila. And like I said, you know, Deborah has the list of standards. It's about 1,200 standards. At this point, all we need is to just say, yes, the standard has an anthropometric dimension. We don't need more. We don't need it solved at all. We just want to know this is actually, because we found, and again, this is stories that Alessandra has told me, you know, like when you search a standard for heads, sometimes they're just the head of a screw, right? And then the standard has been identified as having something to do with humans, but at the end, it's just a screw that was meant, right? So it shouldn't be in the list. So all we're trying to do at this point is to clean up that list.
Thank you. Thank you for clarifying. And hi, Alessandra, if you're listening. There was also a comment, a question from Odo. What about CEN TC 114 on safety of machinery? There are more and more machines in public areas, conveyors in airports, escalators in buildings, machines for retrieval of cans and bottles, paper and cardboard press in publicly accessible spaces, etc. So what about CEN TC 114? Is that part of the identified harmonized
I wouldn't know on top
standards?
of my head, but I would guess so, because I looked at a couple of machinery standards and that definitely have to do with operators, humans. It's definitely on there, yes. You know, how much, you know, if the standards are already inclusive or not, that I don't know, but I would say the TC definitely will be involved.
Thank you. There's also, Frauke, a couple of comments to further feed your research, so I'll have you have a look. But there's also a question from Giovanna. I'm not sure if that one is related to to Jim or if it's related to children. So let's see. For earplugs, we need information on the size of ear canal. Is this also covered?
On the ear canal? What?
Yes. So for earplugs, you also need information on the size of ear canal. Maybe that's more for Sandra.
Yeah, I can answer. In the case of the study of children, we are not going to provide information about the ear canal. So we know that there are interest on this, but it was out of the possibilities of the project. It requires or to gather a print of the ear that should be done by specialized people. And it's not easy to handle this in this type of studies.
Thank you, Sandra. In the meantime, we've received a question from Matthias that is asking whether CEN and CENELEC experts have to contribute to the DG Growth Today study, as shown as the slide 39. You do not have to, Matthias. On a voluntary basis. However, of course, all of the contribution and support to the well-functioning of the study is super welcome to ensure that the methodology developed by the consultancy can be validated, or if not, can be modified and strengthened.
And I think it's a nice warm-up for all of us, because I mean, you know, once we start including this provision in the standardization requests, you know, it will become part of our daily work. And you know, at some point, if we find many standards that we would like to have updated, we will ask for it, right? So I think it's a nice way of warming up to the problem and getting familiar with it, because sooner or later it will land on most people's desks, I'm afraid.
You've been warned.
Yeah.
There's also two questions from James and Otto that are quite linked, which is looking at whether the projects, plural, have been you know, informed to the ISO level. So James is asking, has ISO 7250-3 2015 been considered to inform these projects? And Otto is asking or saying that they wish they could cover children, but they do not have the databases, which is something, Frauke, that I know you are looking at. I don't know if anyone wants to react about the link with ISO.
No, so we haven't involved ISO yet. What I found for a few standards that are being updated is they're using US databases because they often have a bit more extensive databases. And then there's this idea that the US is a multi-ethical immigration country and therefore representative for the whole world, which, you know, not so sure about that one, but okay. So in that sense, you know, when we do a measurement campaign, part of it will be to see what do we need. So we will go through the different standards we have. And if it turns out we need data on ear canals, we should include it. And then B, what's available. So if, you know, data is internationally available, we should use it, I guess, if it's not too outdated. Voila, but that's still to come, I think.
Sandra, do you want to complement?
I can add that in the case of the anthropometric study of children, we have one expert from the ISO group participating in the regular meetings, working as a liaison from ISO to CEN.
There you go. Thank you. Thank you, Sandra. Always good to know that we're advancing in the same direction together. Frauke, I'm not going to ask you about specific hENs that might be in the list, but it's great to see that the railway sector is also considering this. They're sharing with us that our CEN TC256 is using anthropometric data from female and male to design the cabin, so that's really good to know. I think this might be more for Sandra and Gert. However, Frauke, don't hesitate to jump in. We have a question from Dennis that says, do you provide trends of increase for the different anthropometrics data for the 10 or 20 next years?
Yes, we will provide trends because we, in the guidelines, we will give something like a historical framing. What was the situation? What's the actual situation of the data our friends from Spain and from Netherlands deliver? And the historical development shows that there's an explosion in circumferences, body weight, and so on, and fat distribution with children. And there we can see this is a trend. This is a trend from 10 to over regarded a time of about 10 or 20 years, but we can tell how will the development of these body measures be in future. So if you have a long-term product to develop and want to place it on the market, then it's interesting for you whether there has been a development in the last years. Of course, anthropometrists cannot tell exactly what will happen, but we can, of course, say we have a look at the trend going on in the last years. But when, for example, health measures will take place and people will start to avoid fat and sugar in the condition of children, then we will have a different development. But historical framing will be in the guidelines. There are, of course, quite a number of body measures, like in the head or mouth breadth or something like this, which are not part of this development, but those who are will be signed. Thank you.
Thank you, Gert. Thank you very much. We still have 1 minute for one question. Great. Dunny is also asking, what is the age, gender, and percentile of kids to take into account to define the right level of gap to avoid entrapment? I don't know if in 1 minute we can answer to all of those questions. I don't know if one of you want to attempt to do a very, very short answer. Otherwise, of course, Dunny, you'll have an answer in a written format afterwards. Okay.
I think it is more thresholds in minimum and maximum, and will be related to the age range of use of each product. It's different for children products that are addressed to 0 to 3 years old, different from facilities, public facilities that can be used for in any age. So it depends on the applicability.
Very good, very short answer. Thank you so much, Sandra. Els, I'm giving you back the floor.
Yes, thank you very much, Deborah, and thank you very much to all our speakers. I think the input was very valuable. So yeah, there's one more slide. So if you want to get in touch, you have the contact details of Deborah there. And then last but not least, I want to thank you for your participation, for being here, and for your active questioning. You can see here on the slide our upcoming events. So should you want to register to one of them, please feel free to do so. You will receive the presentation in your inbox as soon as possible. So you have all those links right away available for you. So thank you very much and have a nice day. Bye-bye.
Thank you. Bye. Thank you, Sandra, Gerd, and Frauke. Bye.
Thank
Thanks.
you. Bye.